We're about to walk you through how we're going to address the underlying causes of your neuropathy, how we'll rebuild and restore your nerve function while maintaining proper nerve function long term. We've talked about your neuropathy condition, how it's affecting your life, and what your health goals are. Your practitioner has helped you understand the possibility of recovery, in addition to the implications if you don't take action with this chronic condition. We can never get true healing with the drugs, surgery, injections, or rehab approach. These avenues only mask the problems and allow them to get worse, leading to disability and amputations. By contrast, we are treating the underlying causes of your condition and giving your body exactly what it needs to heal itself. You already think more like a neuropathy expert than you may think. For example, what would you do if you saw this plant and you wanted to help it heal? Well, you'd probably give it sunlight, water, nutrients, maybe try to clean up the soil, or if it had bugs on it, remove the bugs, give it some better air. Well, guess what? You're exactly right in your thinking. Every living organism needs specific things to thrive, and this is exactly what we're going to be doing to address your neuropathy. Your nerves need very similar things to a plant to survive and thrive. So now let's look at this nerve chart. On the left, you see a normal nerve. The blood vessels surrounding the nerve are nice and healthy. Through healthy blood vessels, it's supplying the nerve with nutrients and oxygen that it needs to live. As you can see, the middle nerve has a different look to it. It has some constriction of the blood vessels, which is cutting off its blood flow, decreasing the flow of oxygen and nutrients to the nerve. And this is where symptoms of neuropathy might start to appear. If you've had symptoms for some time already, then we need to look at the last nerve on the chart. Here, most of the blood vessels surrounding the nerve are gone. The nerve is completely constricted from blood supply, and the nerve, it's dying off. This is a dangerous stage and concerning. This is where you don't want to be. So if the left nerve is healthy because it's getting a proper blood supply, wouldn't it make sense that we want to create new blood vessels and repair the damaged ones so we can restore the proper blood flow to the nerve? Well, this is exactly what we're going to be doing for your neuropathy. We restore nerve function and health and healing from the inside out. We take a comprehensive approach to treating peripheral neuropathy, and we see the best outcomes for our patients as a result of addressing the body as a whole. A critical and unique part of our treatment plan involves a series of comprehensive treatments that we've developed to put the body back into an optimal position to heal itself. Your body knows exactly how to heal itself. Sometimes it just needs a little help. Let me give you an analogy. If you were to break your arm and you needed to get a cast, does the cast heal your arm or does your body heal it? Well, of course your body does the healing. If I were to cut myself and need stitches, do the stitches heal the cut or does my body? Well, of course it's the body. The cast and the stitches are just putting the body back into the right position to do exactly what it already knows how to do, and that's heal itself. And that's exactly what we're going to do with your neuropathy. Fortunately, we have developed a 5-part therapy regimen that has shown great results for our patients. By leaving no stone unturned, we are able to guide your health toward normal again. It cannot work with a medication, injections, surgery, or exercise. Since there are so many factors that contribute to peripheral neuropathy, a comprehensive approach is needed to treat it. There is no medication, surgery, injection, or rehab exercise that allows nerves to grow back. But our unique approach allows nerves and blood vessels to recover. Most people come to us after trying traditional treatments with little to no results. And finally, because of our unique approach to correcting the cause, our patients are able to get the results they're looking for. Let's cover the doctor-prescribed protocol we use in our clinics across the country. Each and every component is equally important to get optimal results with your neuropathy. Our at-home, doctor-prescribed, FDA-cleared electromagnetic infrared therapy device stimulates the release of nitric oxide into the bloodstream. This technology has 21 peer-reviewed studies with a 97% success rate. The benefits can include increased blood, oxygen, and nutrients to the nerve, and act as an anti-inflammatory. This is based around a Nobel Prize-winning concept by using nitric oxide for your body's overall health. This allows blood vessels to grow back and the nerve to start healing. Without healthy blood vessels and proper circulation, the nutrients cannot get to your peripheral nerves. As we increase the circulation to the nerves and repair the blood vessels, we use our evidence-based neuropathy nutrition support protocol to give the body and the nerves proper nutrients to accelerate the healing process. With our at-home, doctor-prescribed, FDA-cleared electrostimulation device, we are speaking the language of the nerves. Now that we have supplied the nerves with blood supply, oxygen, and nutrients through our infrared technology and our nutritional support protocol, we re-educate and activate the nerves on how to function properly through electrostimulation. Many patients state that this is very calming to their nerves. In our clinic, we believe that education is vital. Throughout care, you will be following the online neuropathy curriculum, along with a manual patient handbook curriculum. This is where you will learn simple lifestyle changes, anti-inflammatory recipes, and neuropathy health tips. This will empower you to be independent with your health. Lastly, your practitioner will prescribe a frequency of in-clinic visits if he or she feels that you need them for full recovery. Your practitioner and their team will be supervising your care and adjusting your care when needed. All of these services are equally important throughout your care with your doctor to get optimal results. By completing your home care with both doctor-prescribed home technologies, following your nutrition protocol, engaging with your education, and lastly, your in-clinic visits, you will be on your way to recovery. Your practitioner has the best plan of action to address the underlying causes of your neuropathy with recovery in mind, versus covering up symptoms with drugs, surgeries, and injections. At this point, we'd like you to start thinking about what your motivations for healing are. Why is it that you want to get better? Is it that you want to have an easier time sleeping at night? Maybe you don't want to lose your freedoms in life, like going on walks, spending time with your family. Or maybe it's the fear of health complications, like disability or relying on medication throughout the day and night. Each person is different that comes through our doors, but it's important for you to understand that your motivations become our motivations. A practitioner or team member will be in shortly to review your recommendations. We'll have a few questions for you to ensure that you're a good fit, and then we can start taking positive steps toward your recovery.